now. All right, we're calling this meeting to order. The Peabody Board of Health will conduct a virtual meeting on Friday, February 11th, 2022 at 11 o'clock. That's now. So we'll call this meeting to order. We have an agenda. There are no items under hearings. Under business, item number 1 would be an update on COVID-19, the data. Sharon, do you want to walk us through an update on that data?
Chairman, did you want to provide an opportunity for the mayor to make a statement before the data report?
I'm happy to do that. Mayor, are you here?
Yes, I am.
All right, you're welcome to address the board. What would you like to tell us?
Thank you, and good morning, everyone. Hope everybody is doing well. I just wanted to take a moment. I wanted to thank the board members, Sharon Cameron and her team. This has certainly been a very difficult grind for all of us, and I'm really appreciative and grateful for your assistance during these very difficult times. There's been a great deal of information that's been presented to us from doctors, from hospitals, from citizens, different reports and everything, very diverse opinions and reports. And, we're all just trying to do the right thing and figure things out. And it's certainly been very difficult. We did have a surge, and I'm very pleased to see over time that the numbers have gone down dramatically. And I feel that we are in a much better place, certainly. And I'm feeling optimism for the first time in a long time. The sun is shining, and I feel like the world is getting back to some normalcy. And I wanted to speak today to ask that the mask mandate be lifted and to allow people the option of wearing masks going forward here in our city and the restaurants and stores and really across our city. I know the schools are a different matter, but in terms of other city operations and city buildings and businesses, that we allow that decision to be optional, up to people to make their own decisions moving forward. I know within the past few days, Salem, Danvers, and Beverly have done the same thing, and I think it's important for us to work regionally together and support one another regionally. And I do believe this is the right decision, and I wanted to come and advocate and speak to that, and ask that the mask mandate be lifted effective upon the vote today.
All right, thank you, Mayor. Thank you for your comments, and thank you for your leadership through this tough time.
And thank you, and I appreciate again everybody's hard work. I feel very optimistic, and I think this would be a big step for our city and for all of us moving forward. So thank you.
All right, very well, thank you. All right, Sharon, can we proceed to the update on the data?
Sure, I'm gonna just change my screen so I can show the data to you. Hold on, please.
Yep.
Okay, so here is the snapshot of the dashboard. This goes up on the city's website every week. And this is the data we had as of yesterday. So as the mayor has indicated, we have seen a significant decline in lots of our most important metrics over the past few weeks. I'll go into these a little bit more fully in the subsequent slides. So this is a picture of what the case count has looked like since the beginning of the pandemic. And you can see we've had 3 significant surges, and we're now showing significant declines from our 3rd and most recent surge. This is one of the most important indicators we have looked at. This is the average 14-day incidence rate of new cases. So the number of new cases we receive on a daily basis over the past 14 days. And it's standardized per 100,000 population so that you're able to compare communities of different sizes. And you can see that, just a few weeks ago, we had a significant peak. 2 weeks ago, our incidence rate was 176 new cases per day on average. And as of yesterday, our average incidence rate is more than half, less than half that, about 54 new cases a day. And you can see that the trend here in Peabody mirrors very closely the trend in Massachusetts. When you look at the 7-day rolling average of incidence rate, it's basically the same sort of picture. We have our most recent number, was 39 new cases per day over the last 7 days. So again, significant improvement from where we were at this time a month ago. This is a picture of our percent positivity, and this is another one of the indicators that's been very important to us. This is the percentage of tests that have been coming back positive. And again, you can see that we had a significant peak in December and January, and now we've had some significant declines. So 2 weeks ago, we had a percent positivity rate of 17.56%. As of this week, our rate has gone down to 7.42%. This is a metric that I know you were very interested in. This is the wastewater data collected by the MWRA. And one of the things I think is really helpful about this data is that the other indicators we've traditionally relied on, the metrics around case counts and positivity rate, now that so much testing is happening outside of the realm of formal laboratories and clinical settings, now that so much testing is happening in people's homes and that testing is not reported to us, those traditional metrics are no longer as reliable an indicator of what's really going on in our community. But this wastewater data is really helpful because it basically analyzes the amount of viral particles found in the wastewater. So it's not really limited by where the testing happens and all those other factors. So you can see, again, we had a significant peak in the month of January and a significant decline since then. One of the other metrics that's been increasingly important to us, again, is the other testing data is not as able to give us as big a picture, is what's going on with hospitalizations throughout our region in our community. So this is a picture from the state's dashboard of the number of people in the hospital on average. And again, you can see those numbers peaked in January and they're coming down significantly. When we look at the capacity, one of the, as you remember, when you were discussing whether to put the mandate in, one of the most compelling factors was the information we'd received from the hospital leaders in our region about the need to ensure adequate hospital capacity for people who needed medical care, not just for COVID, but for all the other medical issues people seek care for. So the measures of bed capacity were a really important metric. And you can see that this is the ICU bed availability. The blue graph is the statewide bed availability, and the orange bars are the availability here in the Northeast region, which is where most of our residents would access care. So a significant improvement in hospital ICU bed capacity between January and February. The data that was released yesterday shows our current ICU bed capacity in this region is about 13% of all beds are available. And this picture is all of the medical surgical beds. Again, the blue is the statewide data. The orange is the Northeast Mass data. And the increase is not quite as significant as in the ICU capacity, but you can still see we've had significant improvement over the course of the last month. As of yet, the data released yesterday, about 4% of the med-surg beds in this region are currently available. So in addition to these positive metrics in terms of what's happening with cases and hospitalizations, we're also seeing, our community vaccination rates are pretty high. We still have some room for improvement in certain sectors, but overall, 82% of our residents in Peabody have received a first dose. 73% are considered fully vaccinated, and 38% have received a booster. So we definitely have work to do, particularly among some of our younger age groups, but these overall numbers are very positive. This is the data broken down by race and ethnicity. And again, we do have work to do here as well, with certain sectors of our community have not accessed vaccine at the same rate as other sectors. And this is the breakdown by gender. So based on these positive developments, both in terms of case counts and positivity rates and our high vaccination rates, I do feel it's appropriate at this time to make a recommendation to you that we lift the mandate. However, I would advise strongly that we need to continue putting out the appropriate public health messages. I think it is important to note that the CDC still does recommend indoor mask use in areas of high and substantial transmission of the virus, and all of Essex County is considered to be in that category at the time. The other piece of data I wanted to show you is when you look at the percentage of our cases in Peabody that have resulted in death, we've had almost 400 fatalities in Peabody. And as a percent of the cases, about 2.6% of the COVID cases in Peabody have resulted in death. And that's significantly higher than most of our neighboring communities, and as well as the state. For the most part, we're more than twice the fatality rate. So I think it's really important for us to remember that we have a particularly vulnerable population here in Peabody. We have a significant proportion of our population is over 65. And I think it's really important that we continue to put out the public health messaging to advise people that when they're indoors, crowded settings, or if people aren't vaccinated, that we should be advising them to follow the CDC guidance to wear masks in those settings. But I do feel it's appropriate to lift the mandate at this point.
Well, thanks for the data presentation and for your recommendation, Sharon. Board members, you've heard the recommendation. Is anyone prepared to make a motion?
I'll make a motion that we follow Sharon's recommendation and rescind the order from December, I believe, 22nd that we put in place, effective today.
All right, Chief, thank you for the motion. Is there a second?
Yes, I second.
Okay. On the motion, before I call for a vote, we've had a practice of allowing people who are in attendance to offer some comments and some insights. I would say that I'd welcome that if the board members are amenable to that. I'd welcome some comments before we take a vote to help us with our deliberations. Sure. It's not a hearing, right? So we're not really required to, but the comments of the residents and community members of Peabody in particular would be interesting to me, and I think to you. Sharon, are there people in attendance who aren't at the participant level and who are raising their hands, who might want to speak? Yeah, there are. I see you nodding. Okay. All right. Why don't I ask this then? Of the people who want to participate today in today's meeting with some comments to help us with this deliberation, let me ask you for a couple of things. Maybe we'll just set a few ground rules. Let's try to keep the comments to the issue that's at hand. That's today, the lifting of the mandate. Rather than to discuss vaccinations and all of the science around that. Let's try not to focus on past actions of the board or future actions of the board, just today's action that's being contemplated. You heard the motion. And then, we've been really fortunate so far through all of this, through a very difficult time. The people who have been offering comments have been thoughtful and respectful and courteous, and I hope we can continue that. I read some of the news reports of some of the other meetings of our counterparts across the state, and it seems to have gotten somewhat difficult. And we haven't had that here in Peabody so far, and I hope we'll continue. So I'll open it up to comments. I hope you'll keep it civil and informative and less repetitive if you can. Why don't we start? Sharon, is there anybody who you want to begin with? I see Kristen. All right, and maybe if you could, because we're recording this and it's live on cable television, and I know we're recording this by taking notes. If you could tell us your name and where you're from for our record, that would be helpful. Kristen, you want to begin? I see the mute icon. There you go.
Hi.
Hi,
Hi, thank you. My name is Kristen. I do live on Kosciuszko Street in Peabody. I am a healthcare professional. I am a registered nurse, and I'm really hoping that the board votes to lift the mask mandate today. And I also hope going forward, I know you don't want us to talk about future, but I do think that it needs to be voluntary. There is lots of evidence that is coming out that's saying that one-way masking does work, and it's always been the way that we do things in the hospital. If people are immunocompromised, we have them wear a mask. We don't have everyone around them masking because the mask does protect them. So I do think that's important to take into consideration when we're going forward. When things are mandated and people feel forced to do things, they become more non-compliant. And I think that if you left it up to people to do what's best for them and make their own decisions, that they'd be more willing to do the right thing.
All right, Kristen, thank you for your comments.
Thank you.
Yeah, all right. There are sometimes during a hearing when I'll ask for people who are in favor first and then in opposition second. I'm more inclined to just allow people to speak as you will, whether you're in favor of lifting the mandate or in opposition to lifting the mandate. So why don't we continue? We heard from Kristen. That was good. Anyone else, Sharon? With their hands raised? Okay. We'll continue this, I think, for about 20 minutes, if that's all right with the board. You know, it's the middle of the day. We can't do it all day. But I find these comments to be helpful in my deliberation. So we'll go until about, let me see, maybe 11:40 with the comments. All right. I see someone on the screen.
Hello. Hi.
Hi.
My name is Ekaterina, and I live in 14 North. So I am just on the CDC website at the moment, and as it's showing, it's recommendation and it's to slow the spread. It never said to stop the spread. So I would like to ask to leave the mandate and leave it to the people and to the parents to decide whether to wear masks and wear masks for their children in schools. And it seems that children don't get sick and don't spread the virus. So yes, I would like it to stay a recommendation for now and for future as well. That is like, we cannot, I agree that we cannot just stay at the moment. Like, we appreciate situation based on the past, and I think that it's better to make decisions for future as well, based on the past and present moment. Thank you.
Thank you, Ekaterina. Appreciate your comments. They're helpful and always welcome. Thank you.
Thank you.
Okay, bye.
Bye-bye.
All right, I'll leave it to you, Sharon, to just let the next person in. Welcome. I see your name, WALLACKB. Welcome. Still having trouble hearing you. We'll give you a minute.
Can you hear me now?
Yes.
All right. My name is Bill Wallach. I live on Birch Street across from the Burke School. First of all, I want to commend the board for taking the action to deferring personal responsibility for individual health care back to us as the residents of Peabody. And I'm all in favor of lifting the mandate. If I could, I just had a quick question with regard to the fatality slide that was shown. Is the death directly caused by COVID, or was there a co-mobility factor and COVID was just part of it?
Well, we'll consider that question as a general comment and a concern about the validity of the data, rather than back and forth with questions and answers. But your point is well taken. It's a concern, and it is something that we ought to consider as we're evaluating the data. I understand. Is there anything else you'd like to tell us?
No, thank you. So based on the approval of the board, is the expectation that the mask mandate would be lifted today?
Well, the motion that was made by one of our members is that it be effective at the vote. So yes, okay. As early as noon, I think, today.
Okay, great. Thank you so much.
Thanks for your comments. Thanks for participating today. Good luck to you. Okay. Well, we're doing well so far, I think.
I don't see anybody else with their hand raised.
All right. Well, we can give it just a minute. Board members, are there any comments? Are there any comments of the board? Anybody want to offer any ideas or comments in your deliberations?
No, I don't have any. The data was well presented again from Sharon. I want to thank her for all her work through this and her team to get us that information to make the decision today. But that's all I have.
All right. Well, we'll continue. We'll take a break and we'll continue with some people. I see. Is that another person, Sharon? Kristen? Kristen, welcome.
Thank you. Can you hear me?
Yes, we can. Yeah. Thanks for joining us. What would you like to tell us?
Well, I missed your previous meeting and reached out to the mayor, and I hope pass some information along to you guys. I do appreciate all that you're doing and working hard for us. I have been advocating for my children to be mask free. We even pulled them out of school last summer or spring to do a partial homeschool program because of the, what I've read about the harmfulness of a healthy person wearing masks, and, we're inhaling our own carbon dioxide and all of those things. So I'm in favor of you lifting the mandates. I really appreciate all you're doing. And I know you don't want us to talk about make it a vaccine issue, which I will try not to do. But in looking at Sharon's graphs, I can't help but notice that the largest spike of cases, which was the recent Omicron, we already had very high vaccination rates at that point. So I think before we try to continue promoting vaccines, especially on young kids who aren't really dying or creating, lots of sickness from this, that we would just do some critical thinking around that as well. So, but again, appreciate you guys and your time and moving this meeting up to today instead of next Thursday. Really appreciate it.
Thank you, Kristen. Thanks for your kind words.
Thank you.
We appreciate your thoughtfulness and your comments, and we'll consider them in our decisions.
Okay, great.
All right. Good luck to you. Do we have anyone else who wants to raise their hand? Yeah, we'll give you a minute. All right, JT, I see your tile on the Zoom screen, and I see your hand up. Welcome.
Hi, good morning. How are you?
Well, thank you. What would you like to tell us?
I live on Buford Road over in West Peabody. I just wanted to, beg the board next time to consider the case count in relation to the population of Peabody. I know I had recently looked up the case count leading up to the most recent mandate, and I think it referenced like 614 cases over a 2-week period. So if you tone that down, it's essentially 0.5% of the population total per week. So you had 1% of the population over a 2-week period of time that contracted COVID. I'm not sure that number, should alarm the Board of Health to the point where they want to institute a mask mandate. Also, in regard to the school numbers, yesterday the numbers came out, and in the state, 6,723, not only students, but staff and students had positive cases over the last week, so the prior 7-day period. There's 911,529 students enrolled in the state's public schools. So that pretty much equates to a 0.75% positivity rate of students over a 1-week period of all the students in the entire state. You know what I mean? Like if you take that number and you just want to apply it to Peabody, I don't have that data, but I'm saying, there's towns across the state that did not have any mask mandates, and even cases over the last, let's just say cases over the last week for the entire state, you get 18,000 cases, which represent 0.25% of the entire Massachusetts population. So I don't think that you can contribute a mask mandate or wearing masks to stopping a spread, stopping Omicron in its tracks, or anything like that. You can't really contribute the mandate in those measures to the peak or the dip of the virus at any given point of time. So I just like to, I want those numbers to sink in, and for people to realize what everyone's arguing with each other about, on Facebook or, within your own friend groups and things like that. You have to start looking at percentages. It can't just be like, this is happening and we need to make this move. It's just like, stop, take a step back, look at the data, see what it really is as a percentage of the population that you're comparing it against, and then use that as a guideline moving forward. And that's all I wanted to say. I appreciate your time. Thank you.
Yeah, thank you, John. Thank you for your thoughtful comments. We appreciate them and we'll consider them in our decisions. Thanks again. All right. If there's anyone else and you want to raise your hand and be heard on this, you're welcome. All right, I see Joe Riley. Joe, welcome to the Board of Health meeting. I'll give you a moment to unmute. All right, welcome, Joe. What would you like to tell us?
I'm not going to take much of your time. I just want to thank you for your time, for moving this meeting up. And I just wanted my voice to, I'm a resident of 6 Travis Terrace in Peabody, should have said that up front. Very much in favor of lifting this mask mandate. And I guess my theme on that would relate specifically to the disproportionate impact on different size business of a one-size-fits-all solution. And you think about going into restaurants and strapping on a mask as you walk through the door, walk 10 feet, get to a table, take the mask off, and then spend the next hour and a half or so maskless. Just never seemed to me like it made a whole lot of sense, particularly given those disproportionate economic impacts, as well as the social civility impacts that we've all seen as a result of some of the mandates that have been put in place. I will tell you that as a resident of Peabody, I'm very proud of the comments that are being made here and the work that you've done to put this meeting together. I work in Salem, and I participated the other night in their Board of Health meeting, and suffice to say, the civility of this meeting and its tone and tenor is quite different. If anybody had that experience the other night, that was my first Board of Health meeting, and I like this one better. So thank you all. That's it for my comments.
Thank you, Joe. Thanks for taking the time out of your day. I'm sure you're as busy as we all are, and your comments are appreciated and always welcome, and we'll consider them in our decision.
Thank you.
Thanks for your kind words as well. It is appreciated. All right. Is there anybody else with their hands raised? No, Sharon? Okay. All right. Well, I was willing to give this another 10 minutes, but if there are no more people who want to raise their hand and be heard, that's okay too. I'll give it one more minute if you don't mind, just to give everybody a chance. Well, all right, we're coming up on 11:30. Maybe one more, Sharon? Yeah, okay.
Hello again. So I just wanted to make one more point that I forgot to make when I first spoke. So in Linfield, there is no mask mandate at the moment, right? And I go shopping over there to Whole Foods, and I sometimes go to Trader's Joe right here in Peabody. And there is no difference at all in, say, compliance with masks, although there is no mandate in Linfield. But people still wear it if they feel they need to. And like a lot of people, maybe because they feel it's crowded place in Whole Foods, and they'd rather wear the mask and go inside. And it's like almost 95% yesterday it was, or maybe it's like a couple of people only without masks. And you go to Trader Joe, here the same. So it's like again, I would ask you to leave the responsibility to people and to parents to decide whether they want to or not, whether they need to or not.
All right, Ekaterina, thank you again.
Thank you.
We'll consider those comments. Okay.
Thank you.
Thank you again. Sharon, anyone else? No? Okay. All right. Well, why don't we close the comment portion now? I think we've given everybody a chance, and I know that I speak for the board and we appreciate the comments, and particularly the tenor and the civility of it all. I do certainly appreciate that. I think it's really a tribute to the citizens in Peabody, and I'm really proud of that. You've heard the motion. We've got the second. Is there any further discussion of the board members on this matter? No? Sharon, anything further to add? No? All right. Well, if the board members are ready, why don't I call for a vote? All those in favor of lifting the mandate, say aye.
Aye.
All right. None opposed? All right, it's unanimous. All right, and that becomes effective immediately. All right, board members, thank you for taking some time out of your day today.
Thanks, Tom.
Happy Friday.
Happy to join you.
Thank you, Doctor. Thank you. Is there any other business to come before the board? No further business?
So I will post a notice to the city's website of the rescission of the mandate, and we will substitute an advisory in its place. I have provided some draft language in the event this vote was taken, so I didn't know if any of the board members had any comments or changes to that document that you would like to see.
I've reviewed it and I have no edits for you. No.
Same here, Sharon.
Likewise.
Well done. Okay. All right. Well, with no other business before the board, I'll entertain a motion to adjourn.
Make a motion to adjourn.
All right. Second on the motion to adjourn. All right. Non-debatable. So I'll call for a vote. All those in favor say aye. Aye.
Aye.
Opposed, no. We stand adjourned. Thank you, everyone.
Thank you.
All right. That concludes the meeting. Goodbye.